Good evening, ladies and gentlemen. I'm Dr. Shanmugraj. I'm a nephrologist at Thangam Hospital at Palakkad. So today, let's talk about chronic kidney disease. CKD affects, let's talk about CKD and its classic symptoms and what the patient should not ignore. So CKD affects approximately 11% of adults worldwide. That is almost 10 to 11 persons out of every 100 persons are affected by CKD. Like in Indian population, it is estimated that this number is close to 15%. It's a long-term condition where the kidneys gradually lose their ability to function effectively. According to KDIGO 2024, CKD is defined as abnormalities in the kidney structure or function with health implications present for at least the last 3 months. It is identified by markers of kidney damage such as albuminuria, that is more than 30 milligram per gram. That is, if you do a test of urine for albumin, if there is more than 30 milligram of albumin per gram of creatinine, it is considered abnormal. There can be other urinary abnormalities such as hematuria, electrolyte imbalances, histological abnormalities if you do a renal biopsy, or imaging abnormalities. Like we have an ultrasound which shows a shrunken kidney, which shows a displaced kidney, or a damaged kidney. All of these would come under the umbrella term of chronic kidney disease. Coming to the function of the kidney, if the GFR, the normal GFR of kidney is more than 90 ml per minute. If this figure comes to less than 60 per minute, again, in the presence of a normal creatinine, again, we should take it as a chronic kidney disease. So, there are a lot of conditions which combine to give us this definition of CKD. So, it is either a problem with the function or with the structure of the kidney. Now, to diagnose CKD, we use certain parameters. We use blood tests to check the creatinine levels and we calculate GFR from that, and we do a urine test to look for any albumin in the urea. Now, presence of other abnormalities like blood cells in the urine would also be considered as abnormal. Once the CKD is diagnosed, our next step would be to determine what is the staging of the disease. Now, the staging of kidney disease is done as per the GFR. Now, the GFR can be calculated as per the creatinine levels, or we can do a even more sensitive test which is done using radionucleotide test, what we call as a DTPA. Now, if the GFR is more than 90, we come under stage 1. Here, basically, the renal function is normal. However, there is some structural abnormality or some risk factor which is likely to cause renal dysfunction. In stage 2, there is mild decrease in the GFR and it stays between 60 and 89. In CKD stage 3, it is between the GFR of 30 and 59. Now, this stage 3 has been divided into 2 parts, that is stage 3A, wherein the GFR is between 45 and 59, and stage 3B, wherein the GFR is between 30 and 44. In stage 4, the renal function is severely depressed and the GFR is between 15 and 29. And in CKD stage 5, the GFR is less than 15. Now, irrespective of the GFR, if the patient is on dialysis, again, we would be calling it as stage 5. Now, how does a patient come to know there is CKD? Now, usually CKD has got very subtle manifestation and a lot of patients are asymptomatic at the time of diagnosis. However, some of the classical symptoms which are present can be fatigue, swelling, especially notable in the ankles, especially towards the end of the day. You can have puffiness of the face, which is present early in the morning after the patient wakes up. There can be changes in urination. There can be changes in the frequency and volume of urine. Now, suddenly the patient starts passing more quantity or less quantity of urine, or there is sudden increase in the nighttime frequency. The patient passes urine 3 times in the day, but has to wake up 4 to 5 times in the night to pass urine. All this can probably suggest a chronic kidney disease. Now, The other symptoms could be the presence of froth in the urine. Now, the patient usually would notice that the urine is progressively getting more and more frothy when he passes, or there can be presence of blood in the urine. There can be shortness of breath. There can be severe anorexia, that is loss of appetite. There can be nausea and vomiting, or there can be muscle cramps. Now, very non-specific symptoms could be just a itchy skin. Itchiness of skin also can be because of rise in or decrease in renal function and rise in serum creatinine. Now, what are the factors which cause CKD? Now, there can be multiple factors. Now, the commonest would be diabetes, and the second commonest would be hypertension. These are the major causes of CKD anywhere in the world. Now, there can be a lot of other causes. Now, family history of kidney disease can probably suggest some hereditary disorders. Now, if there is a family history of diabetes, there is family history of any relative who is undergoing dialysis, all this can probably increase the risk of having CKD. Now, what is very important is early identification and management of kidney disease, because these are crucial in slowing down the progression of the disease. Now, chronic kidney disease often goes undetected in its early stages because of it's in the early stages it is asymptomatic. Unless we do a test and we incidentally detect it, it usually goes undetected. Now, the other symptoms which are present are very non-specific. It's like symptoms like loss of appetite, presence of fatigue can be because of lot of causes, and lot of times screening for renal disease is missed. The gradual onset of CKD again is another problem, because the kidney disease progresses very slowly. Now, as the disease progresses, the person also starts adjusting to it. As a result, he might not realize these symptoms, because all these symptoms have come over a long period of time. Now, another problem is lack of awareness. The person does not know the symptoms. He is unlikely to recognize it as he's unlikely to raise any red flags, and he's unlikely to look for any treatment or evaluation. Now, additionally, CKD symptoms can be masked by other chronic conditions such as diabetes or hypertension. The CKD, if it is undiagnosed, it can lead to very serious complications, including cardiovascular disease, severe anemia, bone and mineral disorders, electrolyte disorders, fluid retention, and finally it ends up in something called as the uremic syndrome, which comprises usually of severe anorexia, fatigue, there is loss of appetite, and the patient can become drowsy and can also become, in extreme cases, can go into coma. To manage CKD and to reduce the risk of complication, there are some essential steps that we have to take. One, we have to do regular monitoring. That is, check EGFR and albuminuria at least once in a year for all patients. Now, patients who are at higher risk, like patients who have diabetes and hypertension, they probably should be screened at an even higher frequency. Now, anybody who is already having CKD is screened as per their severity of the disease. Now, we should control blood sugar and blood glucose level. These two are probably the most important steps that you have to take. The blood pressure has to be treated, and it has to be kept within the normal levels. Similarly, for blood glucose levels, it has to be kept within the target levels. Now, we have to use appropriate medications, and we have to monitor them regularly. Now, another problem which usually comes with chronic kidney disease, electrolyte disturbances, especially disturbances of sodium, disturbances of potassium, calcium, phosphate. Now, all of these have to be regularly monitored, and they have to be managed. Like for potassium, we have to typically control the dietary intake of potassium, which excludes a lot of things that the patient can eat in the diet. Sodium levels, by restricting the salt intake. Calcium and phosphate levels, again, we have to do dietary adjustment along with calcium supplementation, vitamin D supplementation. So all that will depend on the regular follow-up and the investigations which have to be done. Now, Another problem is anemia. Anemia almost always follows chronic kidney disease because a major hormone which uh, controls erythropoiesis, that is a hormone called as erythropoietin, is made by the kidney. Whenever there is a renal dysfunction, there will be disturbances in the erythropoietin secretion and can lead to anemia. Now, anemia has to be corrected again by making sure there is no iron deficiency and by supplementing erythropoietin from outside. Then we have to address bone health. The bone health, again, we have to look at the calcium and phosphate levels, which are very paramount, and we may have to use phosphate binders to reduce the phosphate levels. At the same time, we may have to give vitamin D supplementation to keep the calcium levels normal. We also have to encourage lifestyle changes. We have to encourage the patient to exercise regularly, to stop smoking, and to balance diet. Now, the patient education is very important, and we have to keep counseling the patient, and also at the same time, we have to give advices to modify their lifestyle. Now, in advanced cases, we have to either prepare the patient for dialysis or we have to straight away take the patient on dialysis. Now, according to KDIGO 2024 guidelines, GFR and albuminuria should be monitored at least annually once a CKD is diagnosed. Now, high risk patients, these parameters should be monitored at least twice in a year, and at a very high risk, monitoring should be done at least 3 to 4 times in a year. This regular monitoring is very, very essential. Now, regular symptom checks and regular monitoring, they play a very crucial role in CKD management. Early detection of progression. Regular symptom checks enable the early detection of disease progression. CKD often progresses silently, especially in the early stages when the symptoms are not noticeable. By monitoring the symptoms regularly, changes in kidney function can be detected very early. Now, second, we have to prevent complication. Now, monitoring symptoms such as fatigue, swelling, and changes in urination, they help in healthcare providers by identifying complications like fluid overload, electrolyte imbalances, and anemia. Now, early intervention can prevent these complications from worsening. Adjustment of treatment plans. Now, symptoms like high blood pressure, proteinuria, and declining renal function may require adjustment in the medication and in the lifestyle of the patient. Now, regular symptom checks, they provide information needed to tailor the treatment plans effectively. Now, we also always aim at the improved quality of life. Now, managing CKD early and effectively, we can definitely slow the progression of the renal disease. We can reduce the overall symptoms and improve the overall quality of life for the patient. Now, most important is preparation for advanced stages of the disease. We detected illness early, we can mentally prepare the patient to be prepared for the further symptoms which would come in the advanced disease, and we can plan the treatment accordingly. Now, for individuals at risk of progression to advanced CKD or end-stage renal disease, regular symptom checks can facilitate early preparation for treatment options such as dialysis or for renal transplantation. Lastly, regular symptom checks play a crucial role in CKD management by enabling early detection, preventing complication, optimizing treatment, improving quality of life, empowering patients, and preparing the future care needs. So we have to stay proactive and work closely with the healthcare team to manage the CKD effectively. Thank you.